Hi, good day. I am Fami Bere. Welcome to another conversation with me. Today, we're here to talk about the topic trichomoniasis. A brief introduction. Trichomoniasis is an STI, that is, a sexually transmitted infection that is caused by the protozoan parasite called Trichomonas vaginalis. It spreads mainly through vaginal contact and affects both men and women, although symptoms show more in women. It is one of the most curable STIs, but people do not detect it early because of its unnoticeable symptoms. A brief history. It was recognized since the early 19th century. It was first identified under a microscope by a French physician called Alfred Don in 1836. In the 20th century, due to the advancement of lab techniques, understanding and diagnosing trichomoniasis became more precise. Other signs and symptoms. Many people may have no symptoms. When symptoms do appear, for men, it may come as discharge from the penis. It may also come as a burning sensation after urination or ejaculation. It may also come as a mild irritation in the penis. For women, it can cause vaginal itching. It can also cause pain during sex or after urination. It can also cause vaginal redness. It can also cause vaginal swelling. It can also further cause foul-smelling yellow-greenish discharge, or it can also cause overall discomfort in a woman. Under diagnosis, we talk about microscopy, whereby these samples or discharge is put under a microscope and viewed. Another test that can be used to detect the presence of Trichomonas vaginalis is the culture test, whereby we take out a swab of this culture and it is tested. The most accurate testing for Trichomonas vaginalis is nucleic acid amplification test. This test is very accurate because of its molecular mechanism. Under physical examination, in women, we talk about redness or small spots seen in the cervix during a pelvic examination. We also talk about frothy or discolored vaginal discharge. In men, it's usually normal, but a urethral exam usually exposes discharge or irritation. Under clinical presentation, it generally presents as vaginal or urethral or penis discharge. It also presents as odor, irritation, and general sexual discomfort. For differential diagnosis, we talk about infections and ailments that mimic trichomoniasis. Here we talk about bacterial vaginosis, we talk about gonorrhea, chlamydia, urinary tract infections, and candidiasis. The key difference from trichomoniasis to these infections are trichomoniasis usually has a frothy growth discharge with a strong odor and a strawberry cervix during a pelvic exam. Under causes and risk factors, it is caused by the protozoan parasite called the Trichomonas vaginalis, and its risk factors are multiple sexual partners. We also talk about inconsistent condom use. We talk about history of STIs. We also talk about poor genital hygiene, and we talk about immunocompressed patients. For treatment of trichomoniasis, we talk about the first line drug used in the treatment of trichomoniasis, which is metronidazole, taken orally 2 grams as a single dosage. Another drug that can be used is tinidazole. Furthermore, on management, we talk about making sure that you maintain one sexual partner to avoid infection or the risk of these infections. We also talk about retesting for patients that has once contracted trichomoniasis. We also talk about education on condom use and safe sex practices. We also talk about ensuring genital hygiene is being maintained. For prognosis, it's important to know that with proper treatment, it is curable and it will not cause any long-term issues. If untreated, it can increase the risk of HIV transmission. It can also lead to pregnancy issues and complications like preterm labor. It can also cause chronic genital inflammation. Generally, the outlook for trichomoniasis is excellent if there is prompt diagnosis and there is prompt treatment. And it's important for you to note that retesting after 3 months is very important to ensure that this infection has been cleared. Thank you so much for listening. See you in the next video. I remain Famibere.